Let's stay with the budget and the allocations. Let's bring in James Macharia, Cabinet Secretary, Health. Thank you so much for joining us on KTN Prime.
Thank you, Linda.
You're an accountant by profession. Your sector has been allocated 34.7 billion shillings for the year 2013-2014. Is this sufficient?
I think, Linda, the first thing to clarify is that total budget for health is not 34 billion. It's actually that 98 billion because 64 billion has been devolved to the county governments. And so the 34 billion exclusively relates to national government. Secondly, I think in terms of whether it's adequate or not, the fact that we have prioritized certain areas like free maternity, housing for nurses, recruitment of new nurses, we believe that with a proper allocation of those funds, it will be sufficient.
Is this an amount you're hoping for?
I think, to be frank, nobody gets enough because we are in a developing country and therefore you can't get as much as you want. But having said that, I think we managed to talk to the committees in Parliament and they did their part, and we believe that what we got will be able to sustain our strategies for next year.
So of course a lot of Kenyans would like to know what would be your priority areas 2013-2014.
Well, priorities you go by the manifesto, because if you go by the manifesto, first of all, we promise Kenyans that we shall give them free maternity.
I will actually get back to that.
And then secondly, we said we shall equip our nursing, dispensaries and health centers, which is what we are doing now. So with that, we believe it will be sufficient in terms of our priorities for 2013-2014.
All right, let me take you back to Madaraka Day pledge that was made by President Uhuru Kenyatta, and he said, we will ensure that maternity fees are abolished and that citizens of Kenya are able to access government dispensaries and health centers free of charge. With the amount allocated, is this achievable? If it is achievable, is it sustainable?
I think we have looked at the numbers very, very closely, and for the first 100 days of the new government, we did say that we shall provide the free maternity, and that money has been allocated. And that's why you find that already we have issued notices in the press indicating that no hospital should charge those fees. Secondly, for 2013-2014, an amount of 3.8 billion has been allocated. And that amount will go up in 2014-2015 because as Kenyans get used more to having deliveries in hospitals, the amount certainly has to go up. And we believe that in the future it will be sustainable.
But of course you realize that there is a little bit of a concern from your sector. A lot of the practitioners saying it is not feasible, it is not achievable.
Well, let me tell you, after the announcement, we have done some statistics to determine what has been the impact of that announcement. And we took the 4 days before and 4 days after. And overall, the increase in deliveries went up by about 8.2%, countrywide. But most of those increases happened in hospitals, which means most of the mothers left the hospitals, so they left the slums and they came to the hospitals for deliveries, which is what was required, because previously they were having the deliveries in slums and such places, and as a result, babies were dying, the mothers were dying. And so with them coming to hospitals, we believe that it will reduce the maternal mortality rate.
All right, the other issue that a lot of Kenyans are worried about is the shortage of personnel, because a few days ago, the National Nurses Association was very categorical that they don't have enough nurses. With the amount that you've been allocated, will you be able to sort this out?
I think if you go by what was announced today by the Secretary for Treasury, we shall be employing 30 additional nurses per constituency and additional 10 health workers for a total of 12,000 in 2013-2014 at a total cost of 3.6 billion. I think with that kind of investment, certainly there will be a big impact, and with the recruitment of 12,000 additional workers, nurses and health workers, over time we shall reach the targets which the nurses are talking about.
In a very sensitive sector, 2013-2014, will you make it work with this amount?
We shall make sure there is governance, accountability and efficiency. And as a result of that, we shall certainly make sure it fits our purpose.
So Kenyans can hope for better, improved healthcare.
Already we have tested it. We have gone to Pumwani. You saw the kind of results which we have managed to get. So they can be confident and positive that it will happen.
All right.
Yeah.
Thank you so much for speaking to us on KTN Prime Health. Cabinet Secretary James Macharia speaking to us on the amount that was allocated to the sector in today's budget that was read, and he makes it very clear that he has a lot of plans really for this sector to make sure that everything works out, making sure that there is improved healthcare for Kenyans in the country. Let's see how that goes in the coming days.